السلام عليكم.
عليكم السلام.
عليكم السلام. Okay. So we will start now with the introductory lecture for the course, inshallah. Uh, First of all, most of us will apply for the European Diploma of Anesthesia and Intensive Care exam. Some of us will not apply for EDAIC. But they can apply for other exams which have the same curriculum for EDAIC or European Diploma of Anesthesia and Intensive Care. Okay? The European Diploma of Anesthesia and Intensive Care, either the first part or the second part, needs requirements to fulfill the basic sciences, which is physiology, pharmacology, physics, anatomy, and there is a clinical part included either in the first or the second part. This is the same curriculum for the Egyptian fellowship, for the Arab board, the first part of the Arab board, the first part of the boards in Arab countries, most of the Arab countries, the MSAI, the primary FRC, and so on. Okay, so I will talk here about the European diploma. If anyone wants to ask anything about any other exams, no problem. I will talk about the system of the European diploma of anesthesia and intensive care exam, and then I will go for the structure of the course, inshallah. EDAIC exam is consisted of two parts. The first part and the second part. The first part is in the form of multiple true and false questions. It comes in two papers. Each paper is 60 questions in 90 minutes, and there is a break in between the papers. The first paper is concerned about the basic sciences, mainly physiology, pharmacology. Sometimes physics is included in paper one, sometimes included in paper two. It depends. Okay. Regarding the second paper, it is 60 questions, multiple true and false questions, and concerned about the clinical part, which is the clinical anesthesia, clinical medicine, emergencies, okay, intensive care cases, okay, and some maybe some questions about regional anesthesia related to anatomy, and sometimes there are questions in statistics, maybe one or two questions, okay. The exam, usually the application of the for the exam starts in April, and the exam is held on, I think, the half of the first 2 weeks of September. It's held once per year, so you have to apply for it in April. If you cannot apply for the exam, you have to wait for the next year. Okay. The exam, uh, um, as I told you, the exam you have to apply in April. It is held once in September in different centers according to your country. Regarding the requirements for the first part of EDAIC exam, you have to be working as an anesthetist, as anesthesia resident anywhere. Okay, so you have to provide a document from the place you are working in that you are an anesthetist, that you are working as an anesthetist. Okay. Uh, the results of first part of EDAIC exam are released in I think in November, in December, something like this. and it depends on what's called anchor scoring, which depends on the strength of candidates in the same year and the difficulty of the questions of the exam. So sometimes, and a lot of times, the candidates get out from the exam and they are very frustrated about the difficulty of the exam, and at the end, they all succeed. And the reverse, sometimes they feel it was very easy and so on, and then they find themselves failed the exam. Okay, this depends on the angle of scoring, not a certain point at which you succeed or feel or something like this. Okay, if you passed the first part of the exam, you can apply for the second part of the exam, but after you provide a document from the country you are working in that you are a specialist in anesthesia. In Egypt, for example, to be a specialist, you have to have the master degree or the second part of the Egyptian fellowship. Okay, so according to the country you are working in, you have to provide a document from the medical council that you are a specialist be uh, valid to apply for the second part of the exam. The second part is an oral exam. The requirements are the same topics, which is physiology, pharmacology, physics, anatomy, and the clinical viva cases. Okay, so you have to study the basic sciences and the clinical for the first part, and for the second, we have the same curriculum. The only difference between the first and second part is the way that you are examined by. Okay, the second part, as I said, is an oral exam. This exam is formed of four stations. Each station is concerned about some different topics. The two of the stations are concerned about the basic sciences, which is physiology, pharmacology, physics, anatomy. Okay, sometimes the basic stations you are asked about physiology and pharmacology only. Sometimes you have one or two physics questions. Sometimes you have one or two anatomy questions, and so on. But the main branches which are asked in the basic stations are physiology and pharmacology. Okay? Regarding the other two stations, there is one concerned about clinical anesthesia, and the other one is concerned about the intensive care, emergencies, and so on. Okay, the exam you have to apply. I think this year you can apply for it. I think at the end of December or at the first 2 weeks of January, okay, for the rest of the year. So the application opens once per year for all the timings or the what we can say, I don't know what to say. There is different times per year that the exam will be held in, not single time as the first part. It is formed in different centers in different dates. Okay, but to apply for a center, any center, you have to apply it when the application starts in January. If you want to to do the exam in November, no problem, but you will apply for it in January. Okay? If you missed this, you will not be able to apply for the second part this year. You have to wait for the next year. Okay, regarding the results, you will receive the results if you passed or if you failed the exam in the same day. Sometimes some centers are in site and some slots are online exams. Okay, so you can do the exam for the EDAIC Part 2, you can do it online. Okay, it is cheaper, it is more easier to do, but in fact, and what in my experience, the failure rate is higher in the online exam when compared to the in-site one. Okay, so a DIC part one, as I said, it is multiple true and false question. You have to, every point, there is example, there is a question, have five, you have five choices. You have to check every point if it is right or wrong. Okay, and every point is marked separately. So if you, for example, if the A point is false, false answer, for you, you will take zero. You will not take a negative mark for incorrect answers. Okay. Let's talk about the structure of the course. The structure of the course for you, which is the first time to do for English speakers, because usually I do the course for Arab doctors, which who understand Arabic explanations in between and so on. So the lectures were hybrid between online and recorded lectures. For you, it will be only online lectures or mostly online lectures. Okay, we can use recorded lectures as a part of the course if I have any heavy duties or something like this, so I can't give you an online lecture. I can record the lecture whenever I can and can post it to the website and at the time of the or instead of the online lecture. And I will try to do this in limited occasions to meet you and to try to discuss the topics with you. I think this will be better for you to understand the different lectures. Okay, so what are the recommended sources for the course? The main book I depend on is Dr. Podcast, okay? And which is similar to it is the Master Pass books, okay? Um, I prefer podcast because it is more chronological. When you read respiratory physiology, it is chronological in structure. Master Pass, it is separate topics. You can't find the relation between different topics. It is difficult somewhat. I think you can read it after we end the course and you understand the main information from podcast. You can read Master Pass. It is a good book, but I don't prefer it because it is separate topics not related to each other. Okay, so I think it loses the bond between the information, okay, and make it more difficult for you to understand the very hard topics of basic sciences we will talk about. So we can study the physiology and pharmacology from podcast. We can use the basic. There is a book that's called the Basic Viva book for studying anatomy and physics. The clinical part will be from the clinical anesthesia Viva book. I don't post the picture of the basic Viva book. We have all the books in soft copies, so you can download it if you want to read these box as soft copies. If you want to buy the box, I don't know if you have, for doctors here in Egypt, it is present in Qasr Al Aini libraries. If you are outside Egypt, I think you have medical libraries that have these box. Okay, for doctors applying for the second part of European diploma, I encourage them to read these books, okay, to widen their background to increase the chances of success. There is a new book that's posted by the European Society of Anesthesia, How to Pass the EDAIC. It contains a lot of MCQ questions and questions for the second part. For doctors applying for the first part of EDAIC, there is a book that's called 1000 Practice Multiple True and False Question. And there is a website, but it is paid if you can do it, PMG on examination. You can practice the MCQ for the exam. Okay? For the doctors applying for the second part, I have PDFs, a small box or booklets for questions, uh, mostly updated to the last exams that include most of the questions asked in previous exams, so you can practice this and ask me if you want any help about this. Okay. The lectures, as I told you, will be on Sunday and Wednesday on Zoom. All the lectures will be recorded and the lectures will be uploaded to the website. I will make sure starting from now and then that all of you are added to the website so you can follow the recorded lectures for doctors who cannot catch up with the online lectures due to duties or due to difference in time zone or something like that. So you can return back to the recorded lectures, which will be available for 1 year after the end of the course. The course duration is 5 months, so the lectures will be available for 1 year after the end of the course. Okay. If you have any questions, I'm ready to take it. Do you have any questions?
Doctor, will the subjects be like, will you be teaching separately each subject, like after finishing one subject, you'll be starting the next?
Sorry, Irl, I can't get to what you asked
Will
about.
you be like finishing one subject first and then starting the next subject?
I will. Okay. I usually, Earl, I explain the topics in the same order of primary podcast. So we will start from the respiratory physiology, okay, and then cardiovascular physiology, and then neurophysiology in the same order in primary podcast book. If I stopped at any point, I will start from the same point after that in primary podcast. Is this clear for you, Ear?
Okay, thank you, doctor.
I will show you firstly the primary podcast. I don't know if you know it or not. It is a very popular book. If anyone has any questions, please let me know.
Is this course like for the second part as well? Will you be guiding us for the second part of the exam.
The second part of what year?
EDAIC.
Yes, it is. As I said, year they have the same curriculum. The course, the aim of the course year is to explain the background. Okay, so
Okay.
here we will take the background year. Okay, what's on you? What's on you is to study what we take and then to answer and try to practice the questions of the previous exams. That what's needed from you.
Okay, thank you.
Okay. For example, here we started with respiratory physiology, so I will start to talk about the lung volumes. I will explain these topics. I will sometimes I will add some information. I will tell you that this information is missing in podcast. Okay, this information is wrong in podcast. You have to correct it, and then I stopped here. Okay, so the next lecture I will start from alveolar ventilation or control of alveolar ventilation and so on. Okay, so it's
Okay,
easier
thank
for
you.
you to follow me up after this. Irl, can I ask you, will you apply for the first or the second part?
For the first part, this is Fatima actually.
Sorry?
Fatima.
Fatima. Oh, okay.
Yeah.
Because it's here. It's not written as Fatima. Okay, Fatima.
Okay.
So,
For the
so
first part, I'll be
we will concentrate on MCQ now, Fatima.
okay.
It is as I said to you, it is the same background. The difference in the way of the exam. Okay. Do you have any questions here, doctors? Okay. So we'll start, inshallah, the next Sunday, Bismillah. I will upload the lecture to the website, and then through the days, the next days, I will be assured that all of you are registered and can access the course easily, so you can return back to the recorded lectures at any time, inshallah, for 1 year after the end of the course, inshallah. Okay? Any questions? Thank you, and meet you Sunday, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
عليكم السلام